Hi, good afternoon. My name is Abby and I am a medical technician at this facility. So the goal of this meeting is to further educate you on your procedure and why it's being performed. Additionally, I just wanted to give you a little bit of background as to what is to be expected both during and after the procedure. And then after all of that is said, we will schedule a follow-up for the stitches to be removed and also for the doctor to check out the healing of the procedure site. So it appears that you've been diagnosed with basal cell carcinoma, which was found in the middle of your cheek, commonly known to us as the zygomatic or the cheekbone. So the good thing about this is that you will be undergoing the Mohs surgery in order to remove the cancerous segment of the skin. And this procedure has been shown to cure over 95% of all patients. So that's a plus. So the skin is part of the body system referred to as the integumentary system. This includes your skin, your hair, your nails, basically the outside of the body. With your particular type of cancer, as said in the name, it involves the basal cells. These cells are found in the lowermost part of the epidermis. So your skin is made up of layers consisting of sections. The top one being the epidermis, or the top thin layer. The dermis being the middle layer, which is the biggest, and then the bottom layer, which is the subcutaneous layer. With the epidermis, there are even more layers within it. And the bottom layer of the epidermis, which is already very thin, is where your basal cells are found. Now, your cells are reacting in a way that causes uncontrolled growth, which in turn we call basal cell carcinoma. While this is the most common type of skin cancer, and it's also one of the most common cancers to be found overall. Another good thing is that it typically doesn't metastasize or spread and grow beyond the initial location. So let's go over how this procedure is performed. So this procedure is a multi-step process, but it'll all be done on the same day. So you will be awake during the entirety of this process. And since the carcinoma is on your cheek, you can wear just regular clothes. Although I prefer something comfy because, you're going to be here all day, so might as well be a little comfortable, you know. So Dr. Smith, who is your dermatologist, or skin doctor, is also the Mohs surgeon, and he will be conducting most of the procedure alongside lab technicians and a pathologist, which is somebody who works with the diagnosis of diseases, typically on a microscopic level. So Dr. Smith will be removing a thin portion of the carcinoma using a scalpel while you are numbed by the local anesthetic, and then it will be bandaged temporarily while all of the lab work begins. At this time, you will be escorted to the waiting room. And feel free to bring any material that you might need, reading material, a Kindle, your computer, anything that can kind of ease up on the waiting time, because this procedure can take several hours depending on how many rounds of the procedure you're having to go under. So speaking of that, there can be multiple rounds of this procedure performed, and that's just because skin cancer is typically looked at as an iceberg. So the top part is just the tip of the iceberg. It can be forever deep, beyond what we can just see. So we can't really assess how long the procedure is going to last per person. It just depends on how long it takes once we get in there and see just how deep the cancer has gone. So it could also be much shallower than we initially planned. So either way, we can't really make an estimate. However, it's a good idea to just plan out being at the office all day. So while you're waiting, the lab will be hard at work. Dr. Smith will cut the pieces removed from your cheek into segments, and then draw a map of the segments in order to track their location. Additionally, he will dye each piece to color code each location. So if something is found in one location that's not in the other one, we're able to pinpoint right where even more cancer cells could be, or another problem. So one of the technicians will then freeze these pieces, slice them up in horizontal layers, so kind of like a layer cake, and dye them once more to put them on the microscope slide. Dr. Smith will then come in and examine each segment under the microscope, documenting carefully on the map where any more cancer cells could be located, and will inform you of whether or not more of the procedure needs to take place. So the same steps are repeated if you do have to have the procedure more than once, including, more anesthesia. We definitely want this process to be as comfortable as it can be. And this is done as many times as deemed necessary until there's no traces of cancer left. So after all of this is said and done, the area will be stitched, and potentially a skin graft could be used depending on how big of an area had to be taken out. But typically we can just stitch up the area. After all of the stitching, we will then talk to Dr. Smith for aftercare treatment, including how to best take care of the procedure site in order to minimize scarring. Additionally, risk of infection is something that comes with all surgeries. So if any signs are found, we ask that you please call the office. Please call Dr. Smith and get that taken care of, because we don't want the area to get infected. So now we will schedule your follow-up. And this will consist of Dr. Smith checking the wound site and removing the sutures. So since your procedure will be taking place on the 13th, we can schedule you about a week out, which will result in your follow-up taking place on the 19th or the 20th. So I know this is all a lot of information, and I hope it was easily understood. I have full faith that Dr. Smith and the rest of the team will take this process and make it as smooth as possible.